We're joined by our good friend, once again, Rich Miller, President and CEO of Virtua. Good to see you, Rich.
Good to see you, Steve.
By the way, for those who don't know, we're taping up in North Jersey. Virtua is based?
In South Jersey, in Burlington, Camden, and Gloucester counties. That's our primary service market in South Jersey, outside the Philadelphia marketplace, Steve.
Interesting. You mentioned Philadelphia. Last time we saw each other was in Philadelphia. You had a big conference. You were bringing together healthcare leaders really from across the East Coast to talk about what kinds of things around consumerism?
Really to talk about consumerism, Steve, around how the consumer now will really control the dynamic in healthcare, meaning that price point becomes important for the consumer, so they're going to be shopping for healthcare.
Yeah, break that down a little bit, because you had these folks, by the way, you had members of Congress there, you had government officials from Delaware and the health commissioner from Delaware, from Pennsylvania, representatives from the New Jersey Department of Health, all kinds of folks. But this consumerism, does it have to do with where healthcare is delivered?
It has to do with where healthcare is delivered, how it's delivered, and the cost of healthcare. So it's what they call, Steve, the value proposition. All those things add up to value. It's price, quality, safety, access, and where the consumer gets product. So it's all tied together in a value proposition.
But, Rich, respectfully, how is that any different than what's been going on, say, the last 10 years?
Well, I think the competition for the consumer is going to change. And what I mean by that is premium dollars coming down in certain networks across New Jersey and across the country. So we as providers have to compete for the consumer in a value network and lower our costs to compete appropriately.
So as a hospital,
a
hospital system, how do you get the message out to consumers that the way you're delivering healthcare is beyond just you come into our doors and we'll treat you?
Yeah, and that's a great point, Steve, because it's no longer about them coming into our doors. It's about us reaching out to the consumer before they get sick.
How so?
Well,
give me an example.
Well, we do more encounters at Virtua, for example, in our 3 fitness centers that we have than we do in our emergency rooms. So the goal is, how do we talk to those consumers about health and wellness, pre-illness, and build some loyalty from the consumer to Virtua for care? So if they, God forbid, they do get ill, they come to Virtua for their care.
It's interesting. You talk about, you're talking about loyalty. Is it brand loyalty? Is it, okay, I'm in a Virtua fitness center, right? I'm working out, I'm trying to take care of myself. I'm not sick right now.
Right.
But now I have a situation. I feel loyalty?
Not now, Stephen. That's the problem we're having, because the fitness process is a silo unto itself in the consumer's mind. So they'll come into a Virtua fitness center, but they're not thinking, boy, if I need heart surgery or I need something else, they're not connecting the pieces to Virtua. They'll say, I'll go to Virtua for my fitness, but I may not be as loyal in other products and services on the sick care side. So our goal is to educate that well consumer about other things we do.
But when I first heard, Rich, that you were moving into, excuse me, the fitness area, I was curious as to why this heavy push into health and wellness. Why?
Because there's so much chronic disease out there. I mean, there's chronic, we're really talking about heavy doses of type 2 diabetes with children, with adults right now. Obesity is a major issue. We have high blood pressure. These are the chronic conditions that lead to other issues later on. I mean, there's people walking around, Steve, with diabetes that don't even know they have it right now. So our goal is to make sure we go into the community and say, let's work with you and let's see what's going on with you. If you are a bit obese, you may have a chronic condition you're not even aware of.
Another term, excuse me, Rich, another term that gets used a lot. I mean, again, the healthcare field is riddled with jargon and acronyms. Have you noticed?
Yes, I have. I've been doing this for 40 years. There's a lot of acronyms I've gone through.
Joanne, I tell him, our executive producer of programming, you told me, value networks. It doesn't roll off the tongue, so when I hear it, I forget it.
Right.
And so I needed Joanne to remind me, value networks are what?
Well, they're networks that are priced to meet consumer needs. So the consumer, for example, right now, the cost of healthcare is through the roof.
Right.
So the 20, 30, 40% premium increases the consumer gets, they can't afford. Frankly, they just can't afford it. So now what what insurers are doing is they're coming back to me and saying, I need a cut in premium dollar to make this affordable to the consumer. Because eventually, Steve, what's going to happen is the consumer will buy their own insurance product. Even some point, someday companies are going to say to their consumer, this is my opinion, they're going to say to their employees, here's a voucher, $4,000, go out and buy your product on the exchange.
How would the consumer do that, Rich?
They would have to go to a private or public exchange, look up insurance products, and decide what's best for them.
But respectfully, how would the consumer have the information, the knowledge, the wherewithal to make that call?
It's up to us to educate the consumer about the networks, what physicians are in the networks, what hospitals are in the networks, is their doctor in the network? So we'd have to do a lot of education around, what's in these value networks. So the consumer is not surprised when they come for health care and then they say, oh, I didn't know my doctor wasn't in this, right? I didn't know that Virtua wasn't in this network. Education is going to be important, and Virtua is going to do that. We're going to have to do that for our consumer.
When you see, Virtua has a game plan. Virtua is doing what it's doing. Virtua has been a big supporter of public broadcasting for a long time. We're very aware of who you are and what you do. But there are other folks who we've dealt with who are merging with other folks, right, in the healthcare field, in the hospital field. When you see the mergers going on around you of pretty big systems, what does it say to you, or does it say anything to you about, hey, we need to do X because we see Y going on in the marketplace?
When I look at big mergers, Steve, and I see mergers that are outside local marketplaces, like across the state, for example, I don't see the value, frankly. And why I don't see the value is you can't change the delivery model dynamic in that type of model. In other words, physicians that practice at Virtua in Burlington County and physicians that practice in Bergen County, you're not going to affect change across the state with these physicians, both in product selection and how they deliver care, because they're too far away. So the real value proposition for providers like me is to get your physicians and your hospitals aligned for lower cost and better care. I don't think you do that, and I think we're finding across the country the big systems can't get these delivery models to do what they want them to do because they can't affect change in all these markets. It's too big. It becomes too big.
So before I let you out here, you could see Virtua continuing the way it's been continuing, operating the way you are? You don't feel the need, you have to merge?
I will not merge where I think I can't affect change in the cost and delivery model. If I can't do that, Steve, I won't do it. I'll do it more regionally. I can do that because I can affect change. But I don't think you do it across major county lines and across state lines.
Real quick, Leapfrog Award, what is it?
Well, Leapfrog is a safety award that's really given by industry, big industry leaders. And we're receiving our 3 A's for our 3 hospitals. And then besides that, we've received 2 hospitals of distinction, meaning our 2 hospitals at Marlton and at Voorhees are the top 100 in the country.
Congratulations, well done,
Thank you.
Rich.
Thanks, Steve.
Rich Miller, who leads the operation at Virtua. We appreciate you coming up here. We're up in Patterson, northern part of the state, and Rich travels up to be with us, and we were down with you in Philadelphia last time, which is a great annual conference. We enjoy being there. We learn a lot. Thank you, Rich.
Thanks, Steve. Appreciate it.
Stay with us. We'll be right back.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by New Jersey Council of County Colleges, the New Jersey Education Association, Oscar Health Insurance, New Jersey Sharing Network, New Jersey Resources, ADP, and by NJ Best. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.